Going to be a series of lunch and learn. This is our first one. The goal here is to really kind of let you guys hear some of the common topics that is running, between both the PN and the RN program. I just want you to hear from a different person. You have your instructors that are going to be teaching you this, but I also just want to kind of put a little spin on it so that you can, oh, he was talking about it this way. However you feel like that works for you, stick to it. You know what I'm saying? I'm going to teach it a little different, which is I like straight, like I tackle things head on, straight on. People use some strategies and here and there. That's fine. If it works for you, do it. As you see, I'll give you a big packet, right? And right in the middle of it, as a matter of fact, if you look on the first page here, this thing, you don't need to worry about it, right? When you graduate, especially the PNs, the RNs, you guys are okay. The PNs, when you graduate, I will be seeing you. Like if you graduate this week, the next week, Wednesday, I will see you and go over this with you because you will see it on your test. You get about 30 questions coming from this page. I'm like, what do you mean? Don't worry about it when we get there. That being said, let's go to the page that is talking about ABGs. Arterial blood gases. And I'm not going to do this all by myself. This is a mixture of PNs and RNs. I want you to allow everybody, if they have questions, to ask. Don't think, oh, why is she asking this question? Please don't do that. This is an environment that should be conducive for all of us to study together. ABGs is ABGs. It doesn't matter what level you are. The numbers are the same. You just need to understand it. Does that make sense? Yeah. So if you look at it, you say ABGs, arterial blood gases. That's exactly what that means. Okay, so there are some specific patients that we want to do ABGs on, right? Like, because you go to the hospital, it's not because we just saw you, what's your name? Aubrey. You just saw Aubrey. Aubrey comes in, oh, let's do ABG on Aubrey. No, right? You've got to give some signs and symptoms. And sometimes we don't know what's going on, and therefore we say, okay, maybe it may be related to ABG, so let's find out what's going on. So what are some of the patients that we want to draw ABGs on? Patients with COPD, right? Someone with COPD, we want to draw ABGs on. Well, believe it or not, someone with anxiety who is going through panic attacks, we may do an ABG on too. Panic attack, anxiety, why do we want to draw ABG on? We'll come back to that. Okay, so we do that. Well, maybe someone with diabetes too, we may want to do an ABG on. Even an asthmatic patient, we want to do an ABG on. All right, maybe somebody who is also overdosed on some drug like aspirin, we may want to do an ABG on. All right, and or somebody that, okay, they are having some problems that we truly can't explain. It's like, we don't just know what is going on with this person. We just don't know. All right. Somebody with head injury, you may want to do an ABG on. Like, you want to do an ABG on somebody with a head injury? Yeah, we may want to do that. So, we're going to go through as we look at the numbers and understand the numbers, how to interpret them. When we are finished, we will be going through like related and specifically to disorders. Right? That's exactly what we want to do. I speak a little fast sometimes when I get excited. If I say something that doesn't make sense to you, my accent is bothering you, just let me know. What do you say? I will slow down. I'll slow down and try to explain it to you. Okay? That being said, all right, so before we do an ABG, okay, we know what an ABG is, right? Arterial blood gases. We want to find out if the person's blood is either acidic or alkalinic. That's really the purpose of it. Do they have too much acid in their body or they have too much alkaline in the body? Why are these important? These are important because when you have too much acid in your body, it affects cellular functions. We are made up of trillions of cells. If your cells cannot work well, your body cannot function well. If the cells are not doing well, obviously overall, your body is not going to do well either. So it affects cellular function, and then it affects, systems, then it affects your whole body, then it affects your overall well-being. That's why it's critical. We try to figure out what's going on to make sure that we are able to resolve it. Now, there should be what is called homeostasis. That is balance in the body. There should be homeostasis. That is, you shouldn't have too much acid in the body or too much alkaline. They have to be literally at equal. Okay? When one goes down, that means the other one is up. Or when one goes up, that means the other one is down. What the body wants is on the level where they're supposed to be, the same level. That's the homeostasis that we are looking for. So some disorders or some diseases will make or cause these imbalances. And that's what we want to figure out. What's going on if there is imbalance? And if there is imbalance, let's try to fix it and bring it back so that the body can function the way it's supposed to. That's why we do ABGs. Okay? Obviously, who does ABGs in the hospitals or in the healthcare facility? Whose responsibility is that? Who? Specialized nurse? Who else? Phlebotomist, huh? Respiratory therapist? Okay, but truly is the RT, is a respiratory therapist. But you should know everything about it. Even though it's not within our skills, you should know about it. But it is the RT, the respiratory therapist, that they conduct the ABGs. Then guess what? Once they get it, they're like, here you are with your results. They get them and give it to you to interpret, for you to make decisions in order to take care of the patient. They don't. Well, I mean, they take care of the patients in some other way or form, but it's your responsibility to understand the numbers that they obtain, and then you use it. Before you do, how do we really do ABG? Listen to the name, arterial blood. So what kind of blood are we looking for? Blood that is in the artery. We do not use venous blood. When you're going to stick somebody, let's say you want to draw, what's your name? Khadijah. Let's say we want to get Khadijah's A1C. By the way, what's your name? Brittany, what's the normal A1C? Give me a hand. What's the normal A1C?
Less than 7.
Huh? No.
Less than 7?
No.
Less than 6?
What's the normal A1C? No.
Less than 5?
What's the normal 1C? Less than 6, less than 7 is not wrong, but you should know it's a range. 4 to 6. 4 to 6. Memorize that. A normal A1C is 4. If we do your A1C and it's 3, that's not normal. That's too low. That means you're not eating well. That's a sign of malnutrition. A good A1C, you want it between 4 and 6. Then you have the pre-diabetes, then you have the diabetes, and blah, 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 blah. So you want to get it for you. So if I take a hand and I'm going to draw A1C, what blood am I going to draw? Okay. Venous blood. Does that have oxygen in it, or that is deoxygenated? That is deoxygenated. I draw blood from the vein that doesn't have oxygen in it, and I send that out for us to check all other labs. But when I'm going to do an ABG, I do not use venous blood. What blood do I use? Arterial blood. Does that have oxygen in it or not? Yes. It does. Okay, so first thing, we need a blood that has oxygen in it, and that's what is the arterial blood, and that's what we use to do ABGs, as its name comes from, arterial blood gases, artery. Okay, that being said, I have to do some tests. Sorry, your hand is hijacked. I have to do some tests. There is a test called Allen's test. Allen's test. This thing, information you're getting, doesn't matter even if you're a nurse practitioner or doctor. It's the same for everyone. Okay, so here we are. Now, come on. I like her a lot. Okay, so we're going to demonstrate. First, that's a pulse here. What is this pulse called? Oh, Lord. Oh, Lord. What is this pulse called? Okay, let's go home. I'm leaving.
Not only.
Okay, what is that pause called?
Right. Yeah, where's he at?
Right here. What is it called?
No.
Ulna. You say, I know, I heard you. No, I heard you. Then everybody say brachia and a head and everything. Ulna pause. This is what? The radial pause. And this is what? The ulnar pause. Okay, so open your palms up for me. I want you to look at the color of the palm here. Just take a look. Look at it. Right now you see it, right? It's perfect, appropriate to the skin tone and color, but I want us to do something. Do you see a difference?
Yeah, I found something.
There you go. You see her thumb is turning blue because I've occluded circulation. Okay? Now I let her thumb go. Color is coming back. I gotta go here again and occlude this, and I let this go. The ulna go. Color should return. If color does not return, what does that tell me? It tells me that this artery here is occluded. That means I cannot use this for our ABG, because if I use this for the ABG, I stick it and she develop a blood clot here. That means this hand would not receive what? Oxygenated blood. Well, we may have amputation because I did that. So before you do an ABG, you must assess and test what? Do the what? The Allen's test, which is you occlude the arteries to prevent blood flow to the palm. You release them and make sure that you have circulation. And if you do and both of them are good, you can use whichever one you want, either the radial artery or the ulnar artery. Does that make sense? So before you do an ABG, what is the test you're supposed to do? Allen's test, ALLENS. Thank you. Now you can write your notes. Well, that means we cannot use that arm. We got to use another arm. And we can get arterial blood literally from a lot of places. It doesn't have to be just arm. It's easy to get them from here. That's why we do get them from there. Allen's test. So now, Allen's test is done. We're good. Now we drew the blood. The RT put it in the machine. It read it and it sprayed it and boom, it gives to you. On your ABG report, you're going to see this. pH. Oops. All right, well. pH. There you go. All right, pH. The pH tells us the overall how the body is doing, whether it's acidic, alkalinic, or normal. And on the page that I give you, the numbers may be a little bit off depending on the book you're using, right? But it's literally the same. A pH is supposed to be 7.35 to 7.45. This is normal. This is a normal pH. It doesn't matter what's going on or whatever, this is considered normal. If we have a number that falls within this range, that means that's normal. The pH is normal. Remember, the pH is the main thing that we are looking at. That gives us the overall, assessment of how the body is. And if it is off, we try to figure out what is making this off. That's how you have to tackle it. If you're doing ABG, the number one thing, the first thing you have to do is other than paying attention to the symptoms that the patient is showing, you look at the pH before you look at anything. Start the pH. And then there's another value which is on the record or on the form. PaCO what? 2. And I know you understand this. pH, that measures the acidity or the alkalinity of the blood. PaCO2. Normal PaCO2 is supposed to be 35 to 45. Everything here is normal. Okay? This PaCO2, all right, 35 to 45. Okay, so basically this is measuring, and now hear me out, PaCO2 only measures one thing, respiratory. PaCO2 measures respiratory, but it's a partial pressure of carbon dioxide that is in the body, PaCO2. The CO2, which is we all know is carbon dioxide, right? So it measures the carbon dioxide related to breathing. That's it, breathing. Okay, so your CO2, 35 to 45. And then there's another number on there, which is HCO3. HCO3, which is what?
26.
26. All right. Remember I said PaCO2 measures one thing and one thing only, respiratory. This HCO3 actually measures the body metabolic issues, which has anything else other than respiratory. It looks at everything else other than respiratory. This is respiratory. This is everything else. Does that make sense? Okay. This is how the body is acidic or alkalinity. This is the overall assessment. This is measuring only breathing and breathing patterns and whatever it is that's associated with the patient's status. This is everything else other than respiratory. It could be diarrhea, it could be something the person ingested, it's not a breathing problem. This is what gives you that information. Everything else except respiratory. All right? We call this bicarb. All right? Bicarbonate. All right? CO2 bicarb. And this is the pH. It's like you go to a tree and then you say, oh, that's the fruit. Let's say the orchard tree or whatever, or mango tree. This gives us every information about the mango tree. This is the mango tree itself. These are fruits under the mango tree that gives information about this. Whether the mango tree is doing well or the mango tree is not doing well. These are the fruits of it. That gives us information about that. Does that make sense? This will either pull this down or it will pull this up. The same thing. This can either pull this down or it can pull this up. These are the fruits that are moving. It's like you and your kids. Your kids, one is pulling you this side, the other one may be pulling you the other side. Or this side, the other one, two kids, one is great, just walking with you, and the other, These are the children, this is the mother. How the mother relates, how she looks, and everything is dependent about how these two are acting or going on. Does that make sense?
Mm-hmm.
I don't want you to just look at it like, oh, these are numbers. I relate it to practical stuff. And mom is happy when these two are happy. And mom doesn't look good when the kids don't look good. When this is mad, this will show mad. When this is happy, this will show happy. These two are pulling this. That's exactly how it's supposed to be. Okay, so these are the numbers and we're going to find out how are they going to pull the mother. Okay, so HCO3. What is another value that you see there? SaO2, which is
95 to 100%.
okay.
And that's the oxygen one.
And how about this?
That is PaO2. 80 to 100%.
Do you see this there? BE.
No.
Okay. So let's look at these two. SaO2 and PO2. Let's start with SaO2. Okay, SaO2. SaO2 is oxygen saturation. All right. What is really, when we say, oh, oxygen saturation, what does it really mean? That, huh?
How much oxygen is in your blood?
Well, it's not wrong, but not quite. quite well. It's not wrong. She's okay. And okay, not wrong, a little better than what she said, but let's even make it better.
In the tissues?
Not really. Okay, even better.
It's dissolved in.
What percentage of the hemoglobin is saturated with oxygen? Take this as your who is the oxygen carrier? Hemoglobin. If this is the hemoglobin, what percent of this hemoglobin is saturated with oxygen? That's SaO2. What percent of the hemoglobin? Is it 100%? Is hemoglobin all saturated with oxygen? Boom, we have 100%. If we have the hemoglobin have 50% of the hemoglobin saturated with oxygen, this person cannot survive. They're going to be pretty in bad shape. So SaO2 measures the percentage of hemoglobin that is saturated with what? Oxygen. That's SaO2. That's what you pick up the O2 sensor, right? And you put somebody's finger in there. So what's your SaO2 or what's your oxygen? I want you to understand it today. That SaO2 measures the percentage of the hemoglobin that is saturated with oxygen. PaO2, on the other hand, is different. Partial pressure of oxygen. That measures the amount of oxygen in the blood. Okay, the fact that the oxygen is in the blood doesn't mean you are carrying it. Yeah. Okay, so let me say it again. PaO2. Oh. Well.
Sorry, I'll give her this one.
Okay, good.
Thank you.
You where? Miss Colette, can you help?
Go get more.
Yeah. Actually, I think my original is still on the printer. And if it is not there, take this. Maybe it's 5 more.
Of the whole packet?
Yes. Okay, so SaO2 measures the percentage of hemoglobin that is saturated with oxygen, and PaO2 measures the amount of oxygen in the blood. Hear me out. If you don't have hemoglobin, we can dip you into oxygen, you will still die. The tissue will still die. Wait, but you're giving them oxygen. Somebody's got to carry the oxygen. Who is going to be the one to carry the oxygen? Hemoglobin. So hemoglobin must carry the oxygen. So PaO2 is now, as we know, the amount of oxygen in there. And SaO2 is measuring the percentage of the hemoglobin on there. Okay, so how much hemoglobin is saturated? I want you to know the difference between the two of them. Understand it. Other than memorizing the numbers, you want to understand this. It's very important. Okay? Now we know this. Now this is where the challenge starts. Okay, we understand everything here. So somebody has taught you something, whether you use the tic-tac-toe or Rome is in Italy or whatever strategy you use. Okay, hear me out. I want you to know one thing here on this. Just know that, just know this. If the number is higher than 7.45, higher. If PaCO2 is higher than 7.45, it indicates what? Alkaline. You need to know that, or alkalosis, alkaline. So when it goes up, it's alkaline. And as a student, it doesn't matter how you look at it. It's something you must know. That, wait, when I look at the pH, which is the first thing I have to pay attention to, if I look at it and the number is greater than 7.45, that means that patient is alkalinic. That's what it's a must know. It's something that you can't just, oh, I think. You can't think. It's either you know it or you don't. Then we go to 7.35. If pH is lower than 7.35, guess what? That's it. You must know this. That's the, if you don't know anything about ABGs, this you must know. And nobody can give it to you unless you memorize it and say, wait a minute, 7.35 to 7.45. If the number is higher than 7.45, that's alkaline. The number is lower than 7.35, that's acid. That's the first thing. Okay. Now let's look at this one. PaCO2. Right? If the number is higher than 45, this is acid. This is acid. This is acid. When PaCO2 is greater than 45, that's acid. Remember, it's two guys that are pooling, acid and alkaline, right? If PaCO2 is lower than 35, that's what? Alkaline. It's either you are acidic or you are alkalinic. That's the bottom line. There's a sign-in sheet going on. Please make sure you get it. You sign in. We are almost. No.
Mr. Can you break down why would it be the opposite of what
Well,
pH balance is?
yeah, that's okay. I'll go back to that and explain it. But first, remember, we need to know what the mother is giving, what information the mother is giving us. And you must know this. These things, if you're going to understand ABG, you must know that a pH is greater than 7.45 is alkaline. You must know. We are not interpreting anything. We're just taking them one after the other and saying, if this is greater than this, it is this. If it is lower than that, and my encouragement to you is that when you memorize pH 7.35, 7.45, that's pH. You must know that if pH is higher, this is alkaline. If pH is lower, that's acid. It's something you just, as a student, this is what you must know. Does that make sense? The same way when you take the pH, know that PaCO2, if it is higher than 45, you must know that it's acidic. And if it is lower than 45, you must know that it's alkaline. If you don't study, some people decide, well, I don't need to memorize this. All I need to do is to use the strategy. And if a strategy sticks with you, absolutely do it. And we're going to look at the ACO3 and we're going to try to make it a little easier. And it will be easier. So before I answer the question, let's go to ACO3. All right? ACO3, when the number is lower than 22, it's acid.
Sorry, I don't understand.
Well, I didn't ask you any question. See, you haven't been to college before, you see? That's why he doesn't understand. All right. ACO3. If ACO3 is lower than 22, that's acid. Memorize it. It's you can clean everything and know that, oh, ACO3, if it is lower than 22, is acid. And then if it is greater than 26, this is alkaline. Now hear me, look here. This and that is in the same direction. pH and ACO3 is in the same direction. What do I mean? When pH is lower than 7.35, what is it?
Acidic.
Well, let's go here. When ACO3 is lower than 22, what is it?
Acidic.
The same thing here. If pH is greater than 7.45, what is it? And look here, it's alkaline too. So this is all you need to know. You memorize your pH, and you can memorize your HCO3 and say if they go up, that's alkaline. If they come down, that's acid. It's easy to pair the two of them and memorize that. And then you can say, well, guess what? That's the opposite of this one. Thank you. Okay, thank you. That's the opposite of this one. What do I mean when I say the opposite? That means when PaCO2 goes up, it's not a, what does it, it's acid, it's rather than going down. Because if you look at the pH, and I'm going to delete, we're going to erase this. Let's erase this to make it better, and then we'll go to some interpretation. These are the three things, major things that we have to pay attention to. So remember, when pH goes down, what is it? Acid. Okay. Don't look on the page. Don't look anywhere. Don't look at your sheet. Don't even look on the board. Let's try to write it on your brain. When pH is lower than 7.35, what is it? Acidic. When pH is greater than 7.45, what is it? Alkaline. And you need to know the numbers, the parameters, right? But today we are leaving here and saying, wait, if I look at an ABG and the number is lower than pH is lower than 7.35, that's acid. If it's greater than 7.45, that's alkaline. Well, guess what? Now let's take HCO3, which is bicarb. It goes in the same direction as what? As the pH. Therefore, if HCO3 is lower than 22, what is it? It's acidic too. If if pH is lower than 7.35, it's acid. If HCO3 is also lower than 22, it's what? It's acidic. Thank you. Acid. Yeah, it's acidic. There is an inverse relationship between the pH and the PaCO2. That is, when PaCO2 goes down and it's acidic. On the other hand, when PaCO2 goes down, it's alkaline. That's why we say they go opposite. It's an inverse relationship. And I don't want you to worry yourself and, oh, what if? I want you to know that both pH and HCO3 go in the same direction. And when they go low, it's acidic. And when they go high, it's alkaline. pH and HCO3, they go the same direction. If they go low, what does that mean? Acid. When they go up, it's what? Alkaline. The two of them, the same direction. And then the other one, PaCO2. That's where the opposite comes in. So let's go back. Let me say it again. When pH and HCO3, when they go low, what is it called? And when they go high, what is it? Okay, but you remember, you have to memorize the number. That pH is 7.35 to 7.45, and HCO3 is 22 to 26. So when I know, if I get a number and it's 20 on the HCO3, oh, I know when it's low, it's what? It's acidic. Questions so far?
You said like metabolic, so try to put it together.
Don't put it together yet. Don't put it together yet. You got the numbers. That's the most important thing, and we're going to put it together. See, we're going to put it together. That's nice. Yeah, all of us will. You help us. There you. You help us put it together. So PaCO2 is the only one that doesn't follow the direction of the pH and the HCO3, right? Because when PaCO2 is going down, it's not acidic. It's alkaline. But when PaCO2 goes up, it's acidic. Okay, so now we're going to use some numbers and try to put it together. We're going to start very basic. Should I erase these numbers from the board?
Yes.
Okay, so that's what we're going to do. And you know what they're going to do? They're still going to cheat from the book. See why I like students. You are the best, I know. So let's go here. We're going to erase this. And then let's put it together now. So pH, right? When you get your ABG, please, the first thing you must look at it is what? The pH. And when you get it, ask yourself this question. Is it acidic or alkaline? That's the first question you must ask. You have to establish that point. That, oh, it's acidic. Why is it acidic? Because it's lower, it went down. It's lower than the 7.35. So it makes it acidic. Oh, wait, no, it's not acidic. This is alkaline. Why? Because it's higher than your 7.45 that you know. Then that's the first thing you do. So now let's look at this. So you got your pH. Okay. What's your pen? Okay, pH. Let's look at the pH. 7.81. The first question you ask yourself, what is this? Is it acid or alkaline? Alkaline. Alkaline. If you get this, you are in the right direction because whatever option you choose has to be alkaline something. That's the first thing you establish yourself. Okay, then let's look at the next number. Most of the time, well, based upon how we understand it, let's go to PaCO2. All right? Okay. PaCO2. What is the normal PaCO2? What's the normal PaCO2? 35 to 45. What is this number? Right in the middle. That's normal. That's normal. That's the end. That's normal. Now let's look at HCO3. See, if you don't know the numbers, that I can't help you. You have to know the number, the range. Now let's look here, HCO3. What is this?
Acid.
It's acid. So you have acid. You have acid. And you have normal. So which of the kids is pulling the mother? It's the HCO3 that's pulling the mother. And what does the HCO3 measures? So guess what this is? Say it louder. Metabolic acidosis.
But what is the type of alcohol?
HCO3 measures everything else other than respiratory. It's a metabolic, it's something going on inside the body. Has nothing to do with breathing. That's pulling the pH. Something else, we don't know. It could be, like I said, the guy said his girlfriend left him and he wants to kill himself. Don't do that. In the first place, don't do that. And so he took a lot of aspirin, which is acidic. Well, that cooled this down, and therefore this cooled this down and made it acidotic. So this is a metabolic problem.
Is that an 8-1? An 8-1 should be alkaline, so the 7.81 should be alkaline.
Oh, thank you. That's what I meant to say. Thank you. Here.
That's better.
Thank you. That's perfect. This is what it's in my head and I'm writing something wrong. Okay, so this pulls this guy down, right? And therefore we have metabolic acidosis. Change that number. This, pull this down. If this number is right, it is normal. You cannot choose anything that has anything to do with respiratory. The only time you choose anything which is related to respiratory is if this number is wrong, it's not normal. Does that make sense? Okay, let's go back. We're going to use more numbers to explain this. Okay, Let's use another one. All right, let's see, pH 7.02. PaCO2 53. HCO3 25. Let's ask ourselves the questions. Don't jump. What is pH? Acid. pH is acid. Why are you saying it's acid?
It's too low.
Because it's what?
It's low.
It's lower than. Perfect. PaCO2. Why is it acid?
It's higher.
Because it's higher than 45. What is HCO3? It's normal. So who pulled the mother? So what's going on? Do you understand this? Don't get me wrong. If your tic-tac-toe, whatever works for you, don't change it. If Rome works for you, don't change it. But I'm giving you a third option as to how to tackle this.
Would it ever be both of them here?
Okay, well now you're throwing a wrench. She's throwing a big wrench in there. Yes, at the RN level. That's where the compensation comes in. Either partial compensation or full compensation. We'll tackle it in a second. But you guys get this? All right. All right. What's going on with this patient? What's the first question you have to ask yourself? What is the pH? Okay. Ask the questions, don't jump. What about PaCO2? It's normal. It's not low. What is HCO3? It's normal. Ask yourself those questions. Don't jump. Ask the question. What is wrong with this patient? Nothing. Whatever is going on with this guy has nothing to do with ABGs. It's good. Let's look elsewhere. Does that make sense? Let's go with some other numbers. Now I'm going to be pointing people to tell me. Don't say it as a group. So everybody do it yourself because you never know it's coming to you. All right. Okay. What's your name?
Yeah.
Jessica.
Yeah, right.
Where, girl? All right. Jessica, say what's going on. What's your name? Yeah. You see it. All right. What do you think is going on?
The pH is alkaline.
Alkalosis. Uh-huh.
And then the CO2 is alkalosis as well.
Okay.
And then the HCO.
Okay, so this is alkalosis. This is alkalosis. And what do you say this is? Do you agree with that?
Yes.
Okay, so what do you have here?
You have.
Please allow her. What do you have? It may be
you
wrong.
have Respiratory.
That's absolutely right. Absolutely right. This is respiratory alkalosis. If it is not this, and it's this, that is pulling the pH. This only measures respiratory. That's all it does. It only measures respiratory. That's it. That's it. If the number is wrong somewhere, we know it's respiratory problem. If the number is wrong somewhere here, we know it's metabolic problem. Does that make sense? Okay, now. Let's go here. More coming, more coming. All right, pH. 7.49. PaCO2 45. ACO3 is 29. Okay. Okay. What's your name?
Bree.
Bree or Bree?
Bree.
Bree, okay. Bree, walk us through what's going on.
That's high, so I'll go with it.
Alkalosis?
Yeah, and then the other one's normal,
This is normal.
yeah, and then that's high,
Uh-huh. So what is
so
this?
it's alkalosis.
So what's going on, Bree?
I forgot what the H one meant, but that's high.
So what is
Metabolic
going on?
high.
Somebody help her.
No metabolics.
Is she right? Is she right?
Yes.
Absolutely right. You see how ABG is not hard. It's not difficult. It's not difficult at all. Now, that's all. When you get it, don't rush through it. Slow down. Ask yourself that simple question. What is the pH? What is the PaCO2? What's the HCO3? Who's pulling the pH? And if it is this, you know it's a respiratory. If it is this, this is metabolic. That's simple. Metabolic alkalosis and respiratory, whatever it is. You see how easy it is? It's that simple. Okay, now, let's bump it up just a little bit. Okay. Okay, let's do this. Now, let's use patients because this is also in the PL program. So let's look at it. You have a patient, you're the nurse, right? And this guy was involved in a motor vehicle accident. He went to surgery, and big surgery, femur fracture, went to surgery. I'm in pain. Oh my God, I need some pain medicine. Oh, please. You gave him his morphine. It's ordered for him. 2 milligrams every 2 hours. He's asked for it. He's good. Right? And then you gave him the morphine. You go into his room to assess him, and his respiratory rate, he's breathing maybe like 8 breaths per minute. But when you talk to him, hey, what's going on? Oh, yeah, I'm good. I'm all right. But when you go in there and assess him, and this is his ABGs, you're like, I don't know what's going on with this guy. His respiratory rate is not where it's supposed to be. I want RT to do an ABG. This is what's going on with him. pH is 7.04. PaCO2 is 50. ACO3 is 23. This is your patient. Raise up your hand and tell me what's going on with this guy. Yes.
Respiratory acidosis.
Is she right? You don't have to agree. Is she right?
Yeah.
Absolutely right. This is respiratory acidosis. A patient who is not breathing effectively will hold on to what? Acid. A patient who is not breathing well. What's the normal respiratory rate? What was his respiratory rate? 8. If you're not breathing enough, your problem is you hold on to the acid. And it's the fact that he's not blowing the CO2 out. That's why his PCO2 went up and pulled the pH down to become respiratory acidotic. So patients, sometimes symptoms or whatever is going on with them will give you that information. But let me ask you this then. If that's the case, what's your name again? Kimberly. So we talked about the patient with anxiety. And here she comes in, going through a lot like panic attack, anxiety attack, really anxious. I can't be here. What? Oh, somebody help me. This is your patient. This is your patient. Kimberly is the nurse. Kimberly sees and says, oh no. And then we ask, Kimberly, what ABG problem can this patient experience? What will Kimberly say? Kimberly says respiratory acidosis. Do you agree? No? Who said no? Why do you not agree? Yes. What is she doing?
She's breathing out way too much CO2.
And so she, instead of becoming a, you have to see, I want the understanding. She's the, why? What's going on? I can't, I need to leave. Please, somebody turn it. You see what's going on? She's blowing out too much CO2. When you lose the acid, what do you gain? Alkaline. So this patient will become respiratory. It's a respiratory problem. It's a breathing problem. Therefore, she's blowing out too much. You got, is it 1 o'clock? Man, I'm talking too much. You got a test on what? Farm. You got it. You really got it. Okay? Yeah, eat, please. Oh, hey, come and eat. I forgot. Take some. This is lunch and learn. I forgot there was food. Please, go eat. No, we are not done, but eat. We'll be done in a second. Please, eat. I forgot about the food. Oh, don't like it. All right. I hope this is kind of helping. Right? Is this helping you guys? Okay. Is it helping? Okay.
Like the children clothes.
Yeah. Very realistic. Yeah. Who is fooling mom?
So when did you go back to teaching in class?
Well, ma'am.
Appreciate you. Teaching.
We're going class.
Teach out.
See, I would love to teach, but the KBN says no. It's a rule, it's a law. I can't have everything. I know, but I can do this. But I can't have a class assigned to me. Because I'm a director of a program. If I do that, I'm adding too much to my plate, and I can't. That's the rule that the director of a program, not just one, if you are the director of both the Kenyan and the RN, you cannot teach, you cannot be an instructor. But I can do this. Yeah. So, all right, grab something, sit, and let's finish it. This is good. A lot of, good turnout. Let the other guys know. Well, I think the next thing we're going to talk about will be cardiac, right? Okay, good. Yeah.
What's the other way?
Cardiac. Yeah.
I needed that.
2 times ago.
It's true. Is that on Wednesday?
It will be on Wednesday. Yeah. It'll be on Wednesday. I think Ms. Livingston may teach that. Yeah.
Yeah, cardiovascular is Wednesday, June 8th.
Yeah. This is something we want, yeah, once a month, something. Okay, so let's bring about a little bit about the patient. Okay, so I know I've used that as an example already. Somebody who is diabetic, right, goes into DKA, All right, full-blown DKA. I mean, that explains itself. Listen to the name, diabetic ketoacidosis. DKA will increase the acidity on the patient because there's a whole breakdown of, like sugar, and therefore we have a lot of acid buildup. I guess the question will be, for someone with DKA, would it be a respiratory acidosis or metabolic acidosis? What would it be? Absolutely metabolic. Because it's not nothing to do with breathing. It's inside the body. There's a lot of cascade of breakdown of sugar going on, and the byproduct of the breaking down of that sugar is the acid that they are actually building. So inside the body, if it is not related to breathing, it's not a respiratory problem. It's a metabolic problem. All right? Okay, how about this? You have a patient, right? Has gastroenteritis. How many of you are RNs? RNs, raise up your hands. And RN programs. RN programs, yeah. Okay, the PNs, okay. Gastroenteritis, what is that?
Inflammation of the guts.
Okay. Okay, that's okay.
Your stomach or your intestine, only thing you're touching.
Stomach intestines. And what would you see with someone with gastroenteritis? Diarrhea, vomiting, stomach upset, right? Cramping. Possible. So they have a lot of bowel movement, liquid bowel movement. This is your patient, and I want you to anticipate what ABG problem may this patient experience. Why is it metabolic acidosis? What do you think?
I've always thought about which one, if it's acidosis, will come out your ass. That's what it's.
Oh my.
Yeah, that's why I used to be out all the time.
Yes, everything. So metabolic, if it's coming out your ass, it's going to. Okay, so listen. If you're having diarrhea, it will be metabolic acidosis. Why though?
It's fine.
This is because the reason is this: you have a lot of alkaline in your intestines. You have a lot of alkaline in your intestines, and when you are having bowel movement, you have bowel movement out of your intestines. So as you're going, you're losing the alkaline. You are getting rid of the alkaline. So when you lose the alkaline, what do you gain? Acid. So what do you become? And is it a respiratory problem? And therefore it is acidosis. My bad. Do you get it? So let's turn it around. Let's turn it around. Okay, so here you have a patient, right? Gunshot wound to the abdomen. He has an NG tube to wall suction. Okay, that's what's going on with your patient. You are sucking it out because the abdomen is distended, it's holding on a lot of fluids, and we are sucking it out. What ABG problem do you think this patient may experience? Why?
Because he's losing too much stomach.
That's it. Do you understand what I'm saying? You becoming alkalosis because we are sucking all the acid out. And when you lose the acid, what do you gain? Alkaline. Therefore, you become, is it respiratory alkalosis or metabolic alkalosis? Absolutely metabolic because it has nothing to do with breathing. I want the understanding. I really want the understanding. If it's got nothing to do with the way the person is breathing, it's a metabolic. And if it is not a respiratory problem, the problem is not a breathing problem, and it's from any other way, okay, then we are talking about other stuff. Does that make sense? Okay, now, somebody asked about compensation. Why is one going here, one going there? Okay, compensation are of two types. They are of two types. It's either partially compensated or fully compensated. Okay, and let me explain that. And then we'll look at some few examples and we'll be out of here. Either it's going to be a partial compensation, is full compensation. Compensation occurs when the problem is established and your body tries to fix it. When your own body tries to compensate, fix it, that's where compensation comes in. Okay, so for instance, now let's use one of the examples, right? So let's say the patient has a simple example, DKA, diabetic ketoacidosis. All right, diabetic ketoacidosis. So here they have diabetes, their sugar goes up. The byproduct of that, cascade leads to a buildup of acid, right? So this is their ABG. 7.09. Okay. PaCO2 is 30. And then HCO3 is 18. Now don't say anything. Don't say anything. Name them. What is the pH? What is the PaCO2? Alkaline or acid? Alkaline. What is HCO3? So here you have the pH being acid, PaCO2 being alkaline, and HCO3 being acid. So simple question. Who is pulling mother? No, it's not both of them. Who is in the same direction as the pH? HCO3, thank you. Who is in the same direction as the pH? This is acid, this is acid. We know this is a metabolic problem because it's this guy that is in the same direction as the pH. But why is this not normal? Why is this not normal? This is not normal because the body has realized there's something going on inside the body that is making the body acidic. So it's trying to fix it. It's trying to fix it. So as this is becoming acid, the body is also going to reduce. What is happening? Is it going down or is it going up? It's going down. So the body says, oh, wait a minute. If that's the case, well, then let's try to breathe a little faster and blow out the CO2 to try to fix this acid that is going on. So here you will have this is what is called metabolic acidosis. How is it metabolic acidosis? Because this is in the same direction with the pH, with partial compensation. It's partially compensated. There's compensation when there is an opposite. That is, one is acid and one is alkaline. As opposite. One is acid, one is alkaline. But it's only partial because the problem has not been able to fix yet. If this becomes normal, it becomes full. The body has tried to compensate so that the pH now is normal. It's trying to fix the problem by itself. So compensation comes in when the body tries to fix the problem by itself. So let me go back again. I know it's like, it's a whole lot. Let's go back. Let's look at it. pH is acid. This is how I want you to tackle it. Name them again. pH is acid. PaCO2 is alkaline. HCO3 is acid. And then you ask yourself, what is this? Who is in the same direction as the pH? That is, who is pulling the pH? How do we determine? Whichever one is reading the same, if this is acid and this is acid, this is the one that is pulling this. So if we know that this is the one that is pulling it, what does HCO3 measures? Metabolic. So we know it's metabolic acidosis, but wait, we can't stop there because this is not normal. And since this is in the opposite of this, we know this is pulling, this is trying to go down as well, because remember, Listen to this hand. So look at this hand. They are supposed to be equal on this level. Metabolically, this is what happened to acid. It went down. Numbers, just look at the numbers or the level. Acid went down here. Alkaline stayed up here. These two has to be on the same level. So look at what the body is doing. Trying to bring the PaCO2 down to get to this level to fix it. Does that make sense? It's trying to fix it. That is the reason why HCO3 goes down. PaCO2 is trying to go down to fix the problem. Is it really fixing the problem? Obviously not. But this is pulling this metabolic acidosis with partial compensation. Why is it partial compensation? Because the pH is not full here. Look, if the pH becomes full or the pH becomes normal, like this. Remember, this is RN level. You will do this. And at the RN level, they're going to give you an ABG question. It's not going to be simple. It will be this kind. Okay? Here. 7.36. If they just give you this, okay, 7.36, that's normal, right? 7.35 to 7.45. 7.36 is normal. Well, PaCO2 is alkaline, ACO3 is acid. I really don't know what's going on. There are a few things we can look. Let's look at what other symptoms is the patient showing. That's one. Two. You see, remember, this is the normal, 7.35, 7.45. Right on the border of acid. Right on the border of acid. So look, if it goes just a little bit below 7.35, it's just 7.36. Right on the border of acid. And who is acid here? So guess what? This is literally metabolic acid. Why are we saying acidosis? Because it's right on the border of acid. So this is acid. This is a metabolic acidosis with what? Full compensation. Because now this is normal now. But it won't just be the numbers. There will be other stuff. They'll tell you the guy bumped his head, blah, 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 and he had diabetes, and because of, you're like, whoa, that's exactly what is going on. There's some other symptoms associated with it, and this is confirming that with what is going on metabolically, and this is confirming the metabolic, even though this is normal. These two are in opposite. I know this is metabolic acidosis with full compensation.
So if it's full compensation, the pH only will be the only one that's normal.
Yes, 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 yes. It will be, if it is not, if the pH is not normal, it's never full compensation. It's never. Even if it's partial compensation, the pH will never be normal. Does that make sense?
Yeah.
The pH must be normal to call it full compensation. And if that is the case, the PaCO2 and HCO3 will be opposite. What do I mean? One will be acid and the other one will be alkaline. They will never be in the same direction. Is this helping?
So determining what is the pH nearest and what determines.
Can help, is one of those. In addition to everything else. In addition to everything else that's going on with the patient. Imagine this. Look at this. Imagine this. Imagine this. What is this? What is this? What is this?
So would it be respiratory acidosis because it's closer to
But you're not done saying it yet,
yeah, full compensation, obviously.
is it? Why?
Because it's normal, pH is normal.
Thank you.
So is this what a COPD patient would look like?
If they're fully compensated. COPD will be, or somebody with, the gunshot wound guy who cannot breathe, or someone with a long history of lung cancer who's having problem. This guy will be, they're fully compensated, and it's a respiratory problem. The other symptoms that the patient came with, in addition to the numbers are telling us that, wait a minute, this guy is having a respiratory problem because, well, this is kind of close to acid. It's right on the border of normal. You understand what I'm saying? What if? What if? What if it was this? What is all this?
It would be metabolic.
Alkalosis.
Yeah, fully compensated.
Oh, now you are adding to it.
Sorry.
If because on the options there will be metabolic alkalosis there, 100%, and they will say metabolic alkalosis with full compensation. It will be there. The two of them will be there, and they will tell you metabolic acidosis or metabolic acidosis partially compensated. It will be there. It will be mixed up. And you realize, wait a minute, this is HCO3, it's alkaline, PaCO2 is acid, P7.44. Ooh, that's almost alkaline.
So what am I looking for with my patient? What is going on with them right now?
You have, okay, well, for this guy, metabolic alkalosis, let's see. So this guy has been vomiting all day, all night. And he had a brain injury, or he bumped his head on a car accident. And remember, when you bump your head, right? And you have increasing intracranial pressure, you may start what? Vomiting. They don't have to tell you they have vomited. The person came in with a head injury, blah, 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 with other symptoms, and they can tell you his, like his respiratory rate is this. They'll give you more information. There will be information there that you have to be able to make an informed decision in addition to the ABG to realize, wait a minute. Truly, this is what is going on with this patient. That is, wait, the alkaline is extremely high. So it's 22 to 26, it's 29. Well, that's not too bad. 29. But pH is really on the edge. So what had happened is this. This pulled this up to become alkaline, and this went up to fix the problem and brought the pH back into normal. That's exactly what happened. By the time we did this, the body says, I fixed it. No, you haven't. Because look at these two, they're opposite. Every time you see opposite, one is here and the other one is here, you have some form of compensation. Whether it's partial or full, depend on what the pH is saying. If the pH is off, you have a partial compensation. If the pH is normal, you are fully compensated. Then you have to figure out, is it the acid or the alkaline? Which one, PaCO2 or the HCO3 that pulled it into whatever the situation is. Does this make sense? I want you to definitely go home and read about it and look for more questions. ATI has questions that will help you. If not, just go online, Google ABG iron level questions, boom, it will be there, free. Use your understanding to answer. Even at the API level, there are questions online that you can answer for free. What's that? Yes.
So for this, when you're saying, would you say it's metabolic alkalosis with full compensation? Is that how you would say that?
Which one?
I know this one.
Oh, this one.
How do you phrase? Yeah, how do you phrase it all?
That's exactly right.
Okay, so metabolic
Alkalosis.
with full compensation. Okay.
Why are you saying full compensation?
Because the pH is.
Okay, good. Okay, what if it was this? And they told us that this person has had like vomiting for, let's say, 3 days. What will be your answer to this? You, the same person.
Vomiting for 3 days?
Huh?
You changed the pH.
Oh, yeah. It's still. It's still metabolic. So it's just metabolic, alkalosis.
Okay. Do you agree? She says she doesn't agree. What do you say?
Oh, with partial compensation.
Why?
Because the other two are still off.
No, no, because
Why?
no, because the pH is off.
Yeah, I know.
And so it's not part, it's not.
Well,
I thought
full
partial just-
compensation. Yeah.
okay, okay, I'm sorry.
Full
Sorry, shut up.
compensation is pH is normal,
Uh-huh.
but the PA, CO2 and HCO3 are both off, which means it can only be partially off.
Okay. Well, it's not that. That makes it.
Erase the number.
Erase
He
the
didn't
N,
know.
he didn't realize.
Yeah.
Oh,
that's
oh,
how
oh.
I was thrown off.
Yeah.
My bad, my bad,
Why is
my
that
bad.
normal
It-
then?
Okay, what, okay, you tell me, what is this? You,
So I would say it was metabolic alkalosis partial.
why?
Because the pH balance is elevated and the HCO3 is also.
Your answer is because the pH is not.
No.
That's it, that's your answer, why it's a partial compensation. Why is it partially compensated? Because the pH is not normal. I see partial compensation, it's not full. Why is it not full? Because the pH is not normal. If the pH is normal, it's not partial anymore, it's full. Does that make sense? It's, and they won't just give you, if they give you just the numbers, then look at the pH, where, is it the lower end or is it the higher end? And if they don't do it, or if they give it to you, they will give you other information to help you figure out where the compensation is coming from. Does it help you? Okay, well, we're gonna end here. Okay, obviously, thank you for coming in. I hope this was helpful to you.